Hey everyone, Dr. Shaikh here from the Dentalist, and welcome back to our dental materials series. In the last video, we talked about denture-based materials, and today we're starting chapter 14 from McCabe, which is soft lining materials. These materials are essential for improving denture comfort, especially for patients with sore mucosa, ridge resorption, or after surgery. So let's break down what they are, how they work, where they're used, and clinically, what is its importance. And yes, what kind of questions you might get in your exams. So first of all, you need to understand what are soft lining materials. Soft liners are materials applied to the fitting surface of the dentures to create a cushioning effect between the hard acrylic base and the soft oral tissues. They basically reduce trauma and irritation by absorbing the masticatory forces, making dentures more tolerable for patients with thin, sensitive mucosa, sharp bony ridges, and post-surgical sites. Also in patients with severe ridge resorption. Now, let's talk about the types of soft liners. Soft liners can be categorized in two main ways. Based on the duration, there are short-term liners like tissue conditioners, which are basically used for days to weeks, usually during tissue healing or after denture adjustments. An example of these short-term liners would be Co-Comfort. And then let's talk about long-term liners. These basically stay in place for months, sometimes even longer. An example of this would be Moloplast, GC Reline Soft. These are basically commercial names, so just don't get confused, but these are the examples of basically the materials itself. So another way to classify the soft liners would be based on chemistry. There are plasticized acrylics similar to polymethyl methacrylate, but with added plasticizers to keep them soft. Pro of this would be they're cheap and easy to use, but a con would be that they lose softness over time as plasticizer leaches out. Now, based on chemistry, another type would be silicone elastomers. They're more stable over time and they're softer and more elastic. A pro would be they're durable, they maintain their softness. A con would be that they're poorly bonded to the denture base without primer. Now, let's talk about the composition of these soft liners. So, acrylic-based soft liners like polymethyl methacrylate, they have plasticizers infused in it, like phthalates or citrate-based compounds. They also have additives like ethanol or solvents. And now the silicone-based liners consist of polydimethylsiloxane base and curing agents that help cure the material in heat or room temperature cure. And then there are primers for bonding to acrylic denture base. Remember that. Silicone soft liners require primer to bond to denture base. Okay? Now let's talk about properties of an ideal soft liner. What properties should a soft liner have? So a good soft liner should be soft and flexible for months, biocompatible. It should be non-irritant, and it should bond well to the denture base. It should also be color stable. It should be resistant to tearing, and of course, easy to clean. But unfortunately, no soft liner checks every box perfectly. There are always trade-offs between softness, adhesion, longevity, and hygiene. Now, let's talk about limitations and problems. While soft liners are great for comfort, they do come with challenges. Poor bond strength is one of the main challenges, especially for silicone-based soft liners. Bacterial and fungal colonization also happens, and then plasticizer also leaches over time for acrylic-based soft liners. Hardening and discoloration is also one of the disadvantages. Soft liners could basically tear during cleaning or insertion. So a clinical tip for you is always instruct patients on gentle cleaning methods and regular follow-ups to maintain hygiene and soft liner integrity. Now let's talk about some common exam questions that you could get on this. One of the questions you could get is, what is the primary disadvantage of plasticized acrylic liners? The primary disadvantage would be loss of softness over time due to plasticizer or leaching. Another question you could get is, why do silicone liners require a primer when used with polymethyl methacrylate denture bases? Well, it's because silicone does not naturally bond well to acrylic. A primer helps enhance the adhesion. Another question that could possibly come in your exam would be to name a clinical indication for short-term soft liners. That situation would be conditioning inflamed mucosa before final denture relining. And then there could be a question about, what is a major hygiene concern with long-term soft liners? Well, they could cause fungal growth and bacterial colonization. So in summary, what did we learn today? Basically, soft lining materials cushion dentures and improve comfort. They can be short-term tissue conditioners or long-term. Chemically, they are either plasticized acrylics or silicone elastomers. Silicone liners maintain softness longer but bond poorly without primer. Common problems include leaching, hygiene issues, and bond failure, especially in the silicone type. Clinically used in cases of ridge resorption, surgical healing, sore mucosa, and immediate dentures. So my friends, if you found this helpful, give it a like and don't forget to subscribe. We've got many more chapters coming your way. And if you have any questions, please feel free to write them down in the comments below and I would love to help you out. We will see you in the next one. Take care till we meet again.